Case 34, 2014, age 7-year-old boy with focal seizure and progressive weakness. Definition, presentation of case. The patient has been well until 18 months early with intermittent snacking of his right hand developed, which quickly progressed to involve the entire right arm. Evaluation at another hospital included encephalography that revealed frequent left-sided discharges, magnetic resonance imaging of the head that revealed nuclear atrophy with a lesion in the left motor strip, and a lumbar puncture which normal result of cerebrospinal fluid analysis.
A seizure is a brief episode of abnormal electrical activity in a person's brain. It's like when your radio goes fuzzy when you go through a tunnel, or when your television gets funny picture for a couple of seconds and returns back to normal.
There are many types of seizures.
With some seizures, a person may become very stiff. They pass out and their whole body shakes.
Some people have seizures where they become confused and may have movements that seem silly or don't make sense. They might not respond for a couple of minutes, every now and then, or never because they're on medications to control them.
During the year before this evaluation, the right arm and the right side of the face began to twitch nearly continuously, with more intense focal clonic activity occurring 2 to 20 times per day. There was associated progressive weakness of the muscle of the right arm, more severely distally than proximally. On the right side of the face, increasing spasticity in the fingers and wrists, and subtle weakness of the right leg.
Epilepsy is when a person has 2 or more seizures from something other than a head injury or from being very sick. Having epilepsy or seizures is nobody's fault.
Sometimes people may have different types of seizures with their epilepsy.
Some people with epilepsy may have a reason for their seizures, such as a brain injury when they were born or a trauma that may have occurred.
But for most kids with epilepsy, we don't know the cause and we assume it was something they were born with. There are a lot of medical tests for someone who has a seizure or seizure disorder. These tests are important because they help your caregivers keep your body safe and healthy. One of the most common tests is called an EEG. This measures the electrical wave patterns in our brains.
What do you mean we have electricity in our heads?
Everyone has a pattern of electrical activity in their brains to tell their bodies what to do. An EEG involves meeting one of the nice technicians who will put little wires called leads on and around your head. While the technician places the leads, you will lie down on a comfortable bed and watch your favorite movie for about a half an hour. During this time, the technician will measure your head and place each lead on one by one. For longer EEGs, they may need to use strong-smelling glue to make sure it really sticks and won't fall off. After they place the leads, they will then wrap your head in light, soft gauze. Now you have a silly hat. Later we'll ask you to blow on a pinwheel for 3 minutes to see how fast you can get it to spin. It's best if you can fall asleep for a little bit, so bring your favorite stuffed animal, a blanket, or book to help you fall asleep. And then, except for some funky hair, you get to leave.
Application in nursing. The differential diagnosis of refractory epilepsy is very broad, so this discussion will focus on the differential diagnosis of the patient-specific seizure type, which is rare in children. His clinical seizure activity is most consistent with epilepsy paratials continua, which is defined as almost continuous, regular or irregular muscular clonic twitching affecting a limited part of the body. One consequence is typical perseverance, and the twitching most commonly involves the face, arm, or both.
Let's look at how seizures develop, how they can be controlled, and what each one of us can learn to do if we see someone having a seizure. The brain is an intricate and marvelous mechanism for allowing us to do all the thousands of actions that we need to do each day. It controls our movements, thoughts, emotions, sensations, and the involuntary workings of our inner bodies. It is made up of billions of brain cells or neurons, which operate by communicating in a complex and precise series of electrochemical messages or interconnections. If something disturbs this delicate balance, a misfiring of cells may result in trigger a seizure. What we see as a seizure is really just an outward symptom of the underlying disorder of the brain. A number of factors can upset the brain's normal electrochemical balance. These primary seizure causes can include head trauma from traffic accidents, falls, excessively rough handling or shaking of infants, or other head injuries. Birth trauma from problems surrounding birth, especially lack of oxygen to the brain. Biochemical imbalances resulting from poisoning, drug and alcohol overdoses, blood disorders, or nutritional deficiencies. Diseases, including certain degenerative, bacterial, viral, and parasitic types. High fever, especially in infants. Circulatory disturbances caused by a stroke, hemorrhage, or brain tumor.
Pros and cons, pathology, discussions. Dr. Anna Stemmer return pathology examination of a biopsy specimen of the left frontal lobe reveals a single small focus of intracortical chronic inflammation composed predominantly of CD3 mast T cells scattered in the parenchyma and clustering around small blood vessels. Biopsy and resection specimen of the left frontal lobe. In addition, immunohistochemical staining for CD68 and CD163 release focal marked microglial activation.
If you should see someone having a seizure, first of all, it's most important not to panic and get upset about it. You really need to try and help that person out. So depending on how the seizure presents, if it's a confusional episode, you're just sort of following them around and making sure they don't come to any harm. It's a big generalized tonic-clonic seizure. You need to put the person down on the ground or on the floor, turn them on their side so that they're not going to choke if they spit up or they vomit, and let the seizure run its course.
When they're laying on their side, what's important is put a pillow underneath their head. If they're banging or jerking around, don't restrain them. Just sort of keep them in one place so they don't fall off a bed or fall off a chair, and make them comfortable. Do not put your hands in their mouth.
Absolutely not, unless you want to get your fingers bitten off. So it's an old wives' tale is that you're supposed to put something in their mouth to protect them. Do not put anything near their mouth. Turn them on their side. Protect them from harm. If there's furniture nearby that they can bang against and get hurt, move that out of the way and let it just run its course and keep them comfortable without panicking, without getting upset. Typically, if it's a stranger that you've never seen before, you should call 911. If it's somebody who's known to have seizures, and their seizures are usually self-limiting and they last less than usually 5 minutes, so just let it run its course and keep them comfortable.
I think what scares people the most is that gagging, choking sound that you can hear, but we know that that is just part of the seizure and that they're not having problems breathing. And if you have them in a good position laying on their side with their head to their side, they're not going to swallow their tongue, they're not going to choke, and so you could just let them go through that. And then very frequently they have the snoring sound after the seizure ends. That sounds really scary, but that usually passes as well.
The other thing that often happens is that people turn sort of blue, and whoever's with them, the rescuers or the family members, will think that they're not breathing. But actually they usually do continue to breathe. It's just that the blood is going away from their mouth and their lungs and their heart to their brain. So you don't have to worry so much about respirations and that sort of thing. Turn them on their side, keep them safe, call for help, and let it run its course.
In Sweden applied in Ecuador, 90% of patients with epilepsy that suffered from neonatal hypoxia. The other 10% are patients with heat trauma, meningitis, brain malformations, and tumors, said neurosurgeon Jimmy Hurtado. Both belong to that 90% of patients that Dr. Hurtado is concerned. The first symptom appeared when she was 11. What was happening at first? It is some time that Dr. Hurtado qualifies as advanced seizures, where the child can stay for 30 seconds off.
Right, girls, we're going to have to do that again from the top. It's just not good enough. You know, when you're on stage, everybody can see you. There is nowhere that you can hide. You two at the back especially, you'll be seen, so concentrate, please. From the beginning, following me. 5, 6, 7, 8. 1, 2, 3, 4. 2, 2, 3, 4. 3, 2, 3, 4. 4, 2, 3, 4. 5, 2, 3, 4. 6, 2, 3. The ending. Why are you all coming up at different times? You know that last beat, you've all got to come up together. You're going to look ridiculous. Try it one more time. Face this way, see if that helps. Following me. 5, 6, 7, 8. 1, 2, 3, 4. 2, 2, 3, 4. 3, 2, 3, 4. 4, 2, 3, 4.
Why is she shaking like that? What's she doing?
Can you just move back a little bit, please?
She's still shaking.
Right, Sarah, can you go and get Mr. Bosworth for me? Joanne, can I have my jumper? All of you, can you just go and wait in the corner for me over there? Hi Molly, it's Miss Sharp. We're in the gym and you're okay, but you've had one of your seizures. You're going to be just fine. Alright, just need you to relax, try your best to rest. Good girl, that's right. You're doing really well. Try your best to relax.
Conclusion. Hypnotic followed the typical course of recovery after hemispheric disconnection, with gradual improvement in language function, spatial hemispheres with resumption of ambulation, and return to baseline and strength. Most important, his personality and sense of humor will preserve, and the disease can be expected to start progressing with continuing improvement. Over time, has the entire hemisphere consolidated function control. Thank you.